My name is Jordan Johnson, and today I'm doing a persuasive speech on mental health resources in school. So I'll just go ahead and start. So I was too good at that. When I was in school, I was always one of those kids who spent a ton of time with like the guidance counselor and everything because I had so much going on and constantly needed like extra support. And because of this, I know firsthand what kind of resources are available for kids when it comes to mental health, and surprisingly, it's not a lot. With the growing number of mental health problems in school-aged children, there needs to be more access to mental health services in schools. In 2022, 69% of public schools reported an increase in mental health concerns among their students, according to the National Center of Educational Statistics. Also, according to this source, 49% of public schools reported providing diagnostic mental health services, which is diagnosing a mental health problem, and only 38% reported offering mental health treatment services to students. Kids in schools tend to struggle with their mental health, but due to the lack of resources schools have, students have limited access to mental health services. Being one of those kids in the past, I know firsthand what resources are given. Mental health problems have been increasing in children's ages 12 to 17, and this can end up affecting their grades. Schools are one of the best places to deal with mental health problems because a lot of students feel more comfortable, like they spend all their time there. Everyone feels comfortable in a school, and sometimes they feel more comfortable at the school than their own homes. But schools can only help so much because they're not given that many resources. Today, we will look more into mental health in schools and talk about why the United States should pass legislation implementing more resources in schools. Let's start by talking about how many school-age children struggle with mental health. It is very common for teenagers to experience mental health problems. In 2025, the Center for Disease Control and Prevention collected data regarding teen mental health, and this data concluded that in 2023, 40% of high school students reported feelings of hopelessness in the past year, and 21% experiences symptoms of anxiety in the last 2 weeks. When children face these mental health issues, it can affect their performance in school, which can also make their mental health worse. Because it causes just a cycle of your grades get worse and then your mental health gets worse, and then it's just an awful cycle. Going through mental health issues tends to cause students to struggle in school, especially if they have no way to talk about what's going on. If they don't have a resource outside of school, there's really nothing they can do. When students begin to struggle in school, it causes an added pressure which worsens their mental health. In an article from Clearfork Academy in 2025, Austin Davis states that schools may notice a shift in their classroom if students are struggling with mental health challenges. They may see lower test scores, higher truancy rates, and increased fighting or violence among students. He also talks about the academic pressure being the number one cause of stress in students, which just adds to the issues they may already have. Since 2020, mental health problems have been increasing like crazy in schools among all young people, not just teenagers. The pandemic caused a lot of instability regarding a bunch of students' lives. A lot of parents' jobs were like they didn't know what was going on with them. A lot of students didn't have that safe place to go to that was the school, so they were stuck in that unstable home life. In some cases, the students didn't even feel safe. According to the American Psychological Association in 2023, schools are crucial for keeping kids safe and connecting them with services, but the pandemic completely disrupted those kinds of supports. Now that we've talked a little about what kinds of problems students face, let's talk about why some students struggle getting help. Schools are very important when it comes to mental health, but they are not equipped with enough resources. Many children struggle with asking for help, especially due to the stigma around mental health issues. Because of how much time students spend in schools, the school becomes a vital part of helping kids with their struggles. But schools are not given a lot of resources or money towards mental health services, which can cause students to not get the help they need. According to the National Alliance on Mental Illness in 2024, youth are almost as likely to receive mental health services as they are in an educational environment as they are in a medical environment. from a specialty mental health provider. One of the biggest challenges when it comes to mental health in schools is the lack of resources. There are a lot of kids who struggle with mental health, but there are not enough people, not enough faculty that know how to support the kids that struggle with mental health. I think there's 3 to 1 school psychologists in schools for every kid, like every kid to one school psychologist. Um, The American Psychological Association in 2024 states that while school psychologists are prepared to identify these mental health issues, there's such a shortage that they can't do anything to help all the students. So some students end up not getting the support they need. Now that we know why there are challenges regarding mental health in schools, let's talk about what could be done to help. For there to be more access regarding mental health in schools, the United States could pass a bill implementing more resources. If there's a legislator that forces the government to forces local governments to put more focus on mental health in schools, less kids will be forgotten and that more kids will get the support they need. In January of 2024, a bill was introduced to the House regarding expanding access to mental health services in schools. I don't think the bill has gone through yet. Right now, it's just introduced, but it's in there right now. This bill focused on providing more school-based health providers, which would allow more kids to get the support they need. This could be the solution to what Meg Anderson said in an NPR article all the way back from 2016, where she stated that schools could play a role in identifying student problems and helping them succeed. Yet it's a role many schools are not prepared for. Educators face the simple fact that often because of lack of resources, there just aren't enough people to tackle the job. A lot of local governments don't seem to care about the mental health crisis that is affecting numerous students, but this could simply be because they don't see the problem. Mental health is a problem that is not always visible to the naked eye. It's often a silent struggle. You can't normally see when a person is struggling with mental health, and because of this, the government might not see that there's a problem at hand, and they might not see if there's a problem that needs to be addressed currently. While mental health is becoming something normal to talk about, there's still a long way to go before everyone is getting the support they need. Almost everyone has experienced some kind of mental health issue sometime in their life, and there's a high chance that that happened while you were in school just because of how much time you spend there. You spend so much time there becoming who you are today. While it is very common for students today to experience mental health problems, a lot of schools are not equipped with the resources to help these students, which can cause more distress for the students. Increasing access to mental health services in schools can provide students with a place to properly get the support they need when it comes to mental health issues. This can cause them to not struggle in school. They can get the support they need, and they don't have to worry about having to go outside and pay for support that they shouldn't have to worry about paying for. Something as simple as having someone to talk to could help ease the students' worries, but there needs to be enough faculty trained to do this, which is why we need to focus on mental health in schools. So many students' only resource is a school, and while mental health is often a silent struggle, it's obvious something needs to be done to give every student the chance to get support if they need it. And that is my end, and then there's my works cited. So, yes.